We're glad to have you back. You're watching TVC News. A killer disease known as gastroenteritis is said to have invaded Lagos, southwest Nigeria, with 117 residents affected by the disease. Gastroenteritis, also known as infectious diarrhea, is an inflammation of the gastrointestinal tract, the stomach and small intestine. Symptoms may include diarrhea, vomiting and abdominal pain. Fever, lack of energy and dehydration may also occur. In view of the outbreak, the Lagos State government reiterated the need for citizens to maintain a high standard of personal and environmental hygiene at all times as part of measures to prevent the outbreak of the epidemic, especially the spread of gastroenteritis, also known as vomiting and diarrhea, which has been reported. We have joining us on the news now a medical doctor, Toni Adeyemi, to explain in detail what this means. First of all, is this an advanced stage of the diarrhea that many know?
No, gastroenteritis, as you defined it, is basically what you defined, an inflammation of the stomach and intestinal wall that results in passage of loose watery stool and vomiting. So it's the diarrhea that we've always known. So that's the same thing as gastroenteritis. So it's not really like a killer disease as termed.
Okay, killer disease is like an exaggeration.
Yes, it's a bit misleading. It's a bit misleading,
Thank
yes,
you.
and
Thank
sensational.
You for that. So what are the aspects of human activity that is triggering this disease?
Okay, the most important right now at the moment is our environment. So environmental hygiene is very, very key. We're all aware that we're in the raining season, so we've been having a lot of rain and subsequent heavy flooding, and this has led to spread of a lot of infections, not just gastroenteritis, malaria inclusive, because the mosquitoes also breed faster in this when you have stagnant water around. So this gastroenteritis is actually a fallout of a reduction in personal hygiene and also environmental hygiene. So a lot of the flooding can lead to contaminated water, having contact with our own major source of drinking water, because the gastroenteritis is spread by the fecal-oral route. So it's spread by when contaminated water gets in contact with either our food or our water sources. And when we take this in, it can now lead to diarrhea.
Okay, so the water, a second look must be taken at our water sources.
Yes.
Then mothers may have a tendency during this season to resort to self-medication when some of these symptoms are noticed. As a medical practitioner, what do you advise? Okay,
for gastroenteritis, which is also called diarrhea, it's actually very dangerous because it can lead to dehydration, and it's actually the dehydration that leads to death. However, there are home remedies for treating gastroenteritis. So anytime a child, for a worried mother, is stooling and you notice that the child is passing loose watery stool more than 3 times a day, then the first point of call is to get the oral rehydration salt, also known as the ORS, which is sold and is available in pharmacies. So that's the first point of call, and you now take the child to the health center because they have to look for signs of dehydration and rehydrate on time to avoid severe dehydration that could eventually lead to death. So the ORS solution is the first point of call.
First aid treatment.
Yes, first aid treatment at home when a child has diarrhea.
Now in Lagos State, 117 persons have come down with this disease. Is there any reason for Lagosians to be worried?
There's no reason for Lagosians to be worried. It's actually good that we have this information. What it tells us is active surveillance is being carried out at all our health centers, because when anything is noticed and that is a bit above normal, it's reported to the State Ministry of Health and actions are taken. And actions could include sensitizing the public and also educating them on how to preventive measures during this period. So the public should not be afraid. What they should do is to heighten their own personal and environmental hygiene. Hand hygiene is very, very important during this period. So you need to ensure that before you handle food, you need to properly wash your hands, because that's like the most common route in which the bacteria and the virus that causes gastroenteritis can actually spread into food. So proper hand hygiene is very key. And because it could also spread through your water, you need to ensure that you boil your drinking water because you're not sure of your source of water. So you need to boil, and if possible, if you can also disinfect your water, especially if you have a well in your compound. During this season that we have a lot of flooding, our flooded contaminated water can come in contact with our well, so you need to disinfect your well as well.
All right. Thank you very much, Dr. Toni Adeyemi, especially for the words of assurance.